Hi, I'm Warren Hoagland with We Care Osceola. I'm here to tell you about a critical need in our county. Roughly 20% of our neighbors cannot afford health insurance. And without health insurance, people who have diabetes, COPD, breast cancer, and even simple problems such as high blood pressure go without treatment. Many of the patients that we help through We Care Osceola haven't been seen by a doctor in over 10 years. The following doctors that you're about to see volunteer to help our neighbors who regularly go without health care. Let's find out why they volunteer their time and expertise.
So my name is Dr. Teresa Finn. I'm an endocrinologist, board certified in endocrinology, diabetes and metabolism, and internal medicine. I relocated from Washington, D.C. in 2012, and I came to the St. Cloud area. And the first thing I did when I got here was to find a place to volunteer. Because in every community that you're in, it's important that we give our time to those who are less fortunate, those who cannot get access to good health care. It's a shame, we live in a very developed country, but some people do not get access to good health care. And as I started rounding in the hospitals, I realized that there were a lot of patients who were just coming in and out because they did not have good access to outpatient care. And so I heard about the Council on Aging, and then I decided to offer my services. And I've had some patients who have not returned to the hospital because you're able to control their sugars on the outpatient instead of in the emergency room, where it's just in and out, and there's really no adequate control. And this facility helps them get their insulin and some of their medications through the pharmaceutical companies. And that has really helped these patients. Volunteer work is hard. I mean, you have to make the effort to do it. But it's very rewarding because at the end of the day, you see patients who are very happy, and you as a physician, really, your whole purpose is to make sure that your patients have good health care. And so I would really urge all of you, all physicians out there, especially in this center, we are in dire need of other subspecialties that could help these patients in every possible way. These are patients who sometimes they have 2-3 jobs, but they just don't have the health insurance to get access to good health care. So I urge all of you out there to get involved in joining the Council on Aging so that we can get a good subspecialty practice and internal medicine pediatrics practice in place. Thank you very much for your time.
Hi, my name is Francisco Noda, and I'm an orthopedic surgeon here working at the St. Thomas Aquinas Medical Clinic and the Council on Aging that helped us tremendously and was instrumental in the creation of this clinic. We've been helping here for the past 10 years, and it has provided great joy to myself and my family, my wife that helps here too, providing services for the most needy in the community for Osceola County, which has been so nice to us for the past 23 years. The clinic provides internal medicine, pediatric and orthopedic services, along with nephrology services to the community on a internal medicine side on a weekly basis on Wednesdays, and then I help every 6 weeks for the orthopedic side. Our decision to participate in the clinic was actually a simple one because we wanted to give back for all the blessings that we have received through the years. And even though it takes a bit of time away from doing other things or doing nothing at all, the rewards of the faces of the patients helped. Their joy and their thankfulness for the services provided is a humongous reward that make us keep on going, and we've been doing it for 10 years. My suggestion to my peers will be get involved, participate in projects like this one, because the rewards in terms of happiness and well-being that you will feel and experience from doing this is priceless.
Good afternoon, my name is Dr. Laranaga. It's a pleasure and an honor to have been chosen to have this discussion with you this afternoon. I'm a board-certified nephrologist, a graduate of the Case Western Reserve Universities of Cleveland, Ohio. I have been practicing in the Osceola, Orange County area since 1998. I have been privileged to be quite successful in the community and a busy schedule, and being able to provide not only the nephrological kidney disease management to patients in our community, but also providing the Council of the Aging and St. Thomas Aquinas clinic for close to 9 years now. And it has been a quite inspiring moment for my profession. With the St. Thomas Aquinas being here 9 years, as I alluded earlier, we have been able to give back to the community, which has served us well and made us successful throughout these years. The sense of gratification that we get from serving our fellow humans in a community, people who are truly in need and need the educational support and the medical support to be able to provide them, not only to keep them healthy, but for them to provide their families, has really been an enriched experience that I've had for these 9 years. Some of us may donate to different types of institutions to provide, for example, fight hunger in Africa or other countries. But we cannot forget that our own people in our own backyard require our services in spite of our busy schedules.
You've heard from some of our amazing volunteer physicians and why it is so important for them to give back and what an impact it has made on Osceola County. We have a great need in our community for special dairy care, and we're looking for help. One person can make a difference. One person can change a life. We need volunteer physicians to come and make a difference in Osceola County. Please help.